throw this on quick. Okay. Well, hello everyone. Thank you for watching this recording of the Community Health Worker Scholar session. Please remember to submit your hours on the activity form in the classroom. And then without further ado, I'll hand it over to Ben.
Awesome. Thank you. Hi, everyone. I'm Ben Tinsvold. I am the Community Outreach Coordinator for the Community Health Worker Collaborative of South Dakota, which is an extension of the South Dakota Department of Health, Office of Disease Prevention and Health Promotion. And I'm excited to share a quick overview of the developing community health worker workforce here in South Dakota. So if you have heard of community health workers, it is a relatively new workforce here in South Dakota. We're one of the last states to develop the workforce here in South Dakota, or here in South Dakota, we're one of the last states to develop the workforce across the country. We can still say that we're ahead of North Dakota and Wyoming, but we're pretty much behind all other states. So excited to share an overview of who CHWs are, the work that they do, and where you might connect or work with CHWs in the future. So the first question I always like to ask is, who is a community health worker, or CHW? So South Dakota, along with 26 or 27 other states, utilizes the American Public Health Association's definition of a community health worker. It's a pretty lengthy textbook definition. So that definition is that a community health worker, or CHW, is a frontline public health worker who is a trusted member of and or has an unusually close understanding of the community served. This trusting relationship enables the worker to serve as a liaison or a link or an intermediary between health and or social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. So all of you being currently in school and scholars right now, you're probably used to textbook definitions. For me, they mean nothing to me. I'm a visual learner. So I like to show this visual. This makes a lot more sense to me. So in the center there, we have the community health worker, and that CHW is connected to the community. On the left-hand side, we have community. Being a large yet rural state like South Dakota, a large state geographically, but a small state population-wise, community can have a lot of different meanings here in South Dakota. It can mean that the CHW physically lives in the same community that they're serving. For example, they might live and work in Miller, South Dakota, but they can also be connected to the community because they speak the same language, they're from the same culture, they have the same lived experience, they have the same chronic disease, they have a connection to that community that really builds that trusting relationship. But on the right-hand side, they're also connected and or employed by health services and social services. So really bridging that gap between the community and health and social services, either by being employed directly by those organizations, receiving referrals from or sending referrals to health and social services organizations, and really making that connection and bridging that gap. So to further explain an overview of CHWs in South Dakota, I want to share a quick video with you all that was produced that includes CHWs right here in South Dakota and gives just a little bit more of a wraparound explanation of who is a CHW. So I will go ahead and start this video now. It's also linked in the presentation as well.
Community health worker really serves as a link between patients and both medical services and social services. They really work to develop trusting relationships with patients and then help meet their basic needs by facilitating access to resources and community services as well as healthcare.
So a community health worker, particularly dealing with the Teddy Bear Den, is somebody who works one-on-one with the women enrolled in our program. Our community health worker, Tony, has done a fantastic job of getting to know the women in our program, helping them to seek the resources that they need and find out what exactly is available in Sioux Falls. She's worked hands-on with helping them to lead healthier lifestyles and make better choices.
You know, we just have something in common with the community that we're serving, and then we're just filling the gap between the client and the social service that they need. I'm able to text them and follow up, But then I also have some moms that need some extra help navigating those resources in the community for whatever reason. So it looks different with everyone. And sometimes I don't get to what they need until we build that relationship and have conversation. And then through the conversation, then usually I can, target things that I know we have resources in our city that will help them.
So once we identify patients have barriers to their health, we get the community health worker involved. The community health worker will then come up and meet the patient prior to them even being discharged from the hospital to just help establish that trusting relationship so that when they're discharged home, then our community health worker continues to work with them. She can go out to their house, she can meet them at a safe place in the community and help them identify what they need to be successful. So she'll continue to follow them, continue to assess their needs until they really feel like they can manage their health on their own and their challenges on their own.
A professional that works outside of the walls of the healthcare system, bridging the gap between what's available in the community from a resource standpoint with what we have to offer here within the hospital from a medical standpoint.
Life is about connecting people, and if your basic needs aren't taken care of, nothing else really matters. It's not that people don't care. They do. They just don't have the simple things or the things that we find simple at their fingertips.
Some other more specific qualifications that are suggested are either living in or being familiar with the community in which you're going to work, being able to effectively communicate with patients of all backgrounds, nationalities, socioeconomic statuses, and then also having some experience navigating the health and social services that are available locally.
So community health worker is a public health worker. Their biggest responsibility is to help connect patients and clients within the community with available resources, with a goal of improving the health outcomes of patients.
This job is really about what are my resources that I can tap into to help patients in the community. And so you really have to know what those resources are.
My scope of work as a community health worker is very broad. I do a lot of navigation of both health and social services, connecting patients to different resources. I also act as an advocate for patients. A lot of patients have difficulties voicing their concerns and problems that they have, and if they trust me as a community health worker, I'm able to get their consent and then advocate on their behalf. I also do a lot of filling in of gaps of patients. For example, if a patient is discharged home from the hospital, I'm able to make sure that they have food the day they're discharged before other services pick up the next day. For the most part, I try to connect with patients before they leave the hospital to make that initial connection, whether it be in the inpatient unit or the ED department before they're discharged home. After I make that initial connection with patients, most of my follow-up visits take place in their homes. Being able to do home visits with patients is really a unique element to the community health worker program, as it just really gives me a good insight into the person as a whole and really helps me see some of the barriers that maybe aren't brought up when they come into the healthcare setting. And I also do phone visit check-ins with patients maybe that are not open to home visits or patients that are further along in the program that just don't require as much hands-on work. Another really important thing I think for CHWs is to have many avenues of communicating with patients. Phone calls aren't just the only thing that I do. I have a lot of patients who have high anxiety and they just physically can't make a phone call. So I offer the option to text me and email me any way that they're comfortable with communicating. And then it's also fun to watch that grow. The patients that maybe started with an email move to texting, and then pretty soon they're comfortable enough to call. And then when we get to that point, I'm able to work with them and teach them how to make phone calls to schedule their own appointments or to call and ask a question of their doctor.
And so sometimes that'll look like maybe just giving them the information, but also it might be making them as comfortable as possible. So sometimes I do have to say, like, Tina is there, she's expecting your call, this is what you say when you enter, or this is where she will be at her desk. Because sometimes just giving some of them the familiar details will give them the confidence to, follow through and access that resource.
The biggest benefit I see from patients that have worked with our community health worker is that they become empowered. They are able to manage their own health after working with our community health worker and really empower the patients to take control of their own health, take control of some of those challenges, and make their lives easier.
So that video really captures the work that CHWs do here in South Dakota. We have two titles that we use for community health workers here in South Dakota. The first is a certified CHW, and this is an individual who's completed an approved CHW training program and applied for and received certification in South Dakota. And a certified CHW in South Dakota works under the American Public Health Association's definition of a CHW. Certification is managed by the Community Health Worker Collaborative of South Dakota on behalf of Department of Health, as well as Department of Social Services, specifically the Division of Medical Services, who oversees South Dakota Medicaid. And certification requires an individual to complete an approved training program, which is at least 200 hours of training, which is typically offered online, and then 40 hours of shadowing, as well as a background check, and also a supervisor, or if they're not currently employed, then looking at an instructor's reference for them to work as a CHW. And a community health representative, or CHR, is an individual who has completed an approved CHR training program through Indian Health Service and works under the APHA definition of a CHW, as well as the IHS definition of a CHR. In South Dakota, we have 9 tribes, and all 9 tribes have employed CHRs across their tribal nations for over 55 years now, since 1968. And so we really wanted to continue to utilize that respected title of community health representative. They're very well known in their community. And so we want to continue to utilize that title as they work across South Dakota. So a quick timeline of how the community health worker workforce developed here in South Dakota. As I mentioned, CHRs have been established across our 9 tribal nations since 1968 and through the early 1970s. By the mid-70s, all 9 tribes employed CHRs, so they've had decades of experience working across South Dakota. But for the rest of the state, in 2015, the South Dakota Department of Health conducted an environmental scan and statewide analysis and really worked to connect with 45 key stakeholder organizations across South Dakota to better understand if there was interest in developing the community health worker workforce. Overwhelmingly, the response was that this sounds like a good workforce to develop. There's certainly going to be challenges, but something that's certainly needed here in South Dakota. So in 2016, the Department of Health and Department of Social Services co-facilitated a work group to develop key recommendations for CHWs in South Dakota. And then in 2017 and 2018, the South Dakota Department of Social Services worked to draft a Medicaid state plan amendment and then submitted that state plan amendment to the Centers for Medicare and Medicaid, which brought us to April 1st of 2019. Department of Social Services, who oversees South Dakota Medicaid, announced that CHW services would be a covered service of South Dakota Medicaid as a fee-for-service reimbursement. So just because there's reimbursement doesn't mean that a workforce magically developed. So in January of 2020, the Community Health Worker Collaborative of South Dakota launched as an extension of the South Dakota Department of Health to really focus on developing the workforce here in South Dakota. So fast forward a couple of years to where we're at now. January 1 of 2023, the CHW and CHR voluntary certification launched in South Dakota. It's voluntary because it's not required unless you work for an organization that is seeking Medicaid reimbursement for services provided to Medicaid recipients. Our first CHW Medicaid claim successfully processed in South Dakota, although the reimbursement was approved and announced on April 1st of 2019. It took all the way until March 16th of 2023 for the first claims to successfully process. And that's because it took a while for CHW programs to develop, individuals to be hired and trained and begin working as CHWs. And then it took a while to work through and make sure that the Medicaid system for claims processing was able to accept the CHW claims and bill them successfully. So since March 16th of 2023, we've had hundreds of claims now processed from many different organizations across South Dakota. And then in June of 2023, there were additional Z codes for social determinants of health that were approved by South Dakota Medicaid. So that expanded the reimbursable supports that CHWs could provide to patients as they work with them across South Dakota. And then July 1 of 2023, Medicaid expansion started in South Dakota, opening the door for approximately 50,000 more South Dakotans to be able to access Medicaid, which then expanded the number of individuals who would be able to work with a CHW, and subsequently that CHW organization could bill for those services. So where are we at now? As of October 1 of 2023, we have just over 200 CHWs and CHRs across South Dakota. We have 115 CHWs practicing across South Dakota in many different locations, from medical settings such as a hospital, clinic, or emergency room, to community-based nonprofit organizations such as a homeless shelter. We have CHWs who are working in different public-facing roles, such as through EMS programs. They're cross-trained EMT CHWs. We also have CHWs working in dental programs and many other types of organizations as well. So from January of 2020, when I started in my role to develop the CHWSD until now, we've developed 115 positions and continue to grow and develop positions across South Dakota. And then we also continue to work with our 85 community health representatives across our 9 tribal nations. And we currently have about 20 individuals in training for the fall training programs here in South Dakota. So the scope of work for a CHW is threefold. This really dates back to 2016 when South Dakota Department of Health and Department of Social Services co-facilitated the work group to develop key recommendations. The scope of work is really threefold: health system navigation and resource coordination, health promotion and coaching, and then health education, specifically to teach or promote methods and measures that have been proven effective in avoiding illness and/or lessening its effects. So first, health system navigation and resource coordination is really looking at helping a patient navigate through the complexity that is healthcare, and navigating through working through scheduling appointments, getting to appointments, following up from appointments, being able to discuss questions with providers. And then resource coordination is really looking at addressing social determinants of health needs or barriers to your health that aren't directly your health. So coordinating and working with patients or clients to overcome food barriers, housing concerns, transportation concerns, really helping individuals to be able to overcome those barriers so that they can then focus on their health. Health promotion and coaching is really looking at working with individuals to make positive contributions to their health. So decreasing or eliminating tobacco use and alcohol use, eliminating drug use, and really being able to go into the home and connecting with the patient or client and be able to open up the cupboard doors and take a look at what food they're consuming, open up the fridge, look at what food is in their fridge, but then also looking and seeing if there isn't food or if it's not the correct food for their dietary restrictions, then helping them to coordinate with resources in their community to be able to access the food that they need. And then also health education. And this is really meant to build upon health education that's provided by a licensed professional. So a CHW might attend an appointment with a patient and attend that appointment in the clinic setting and sit through the same education that the patient is receiving, but then a week or two later, they might follow up with that patient or client in the home setting and build upon that education and be able to provide that cultural translation and reiterate and build upon what was shared by a licensed professional. So a few slides about Medicaid reimbursement in South Dakota. I know it's a really boring topic, but it's exciting because we are one of the few states to be able to bill for CHW services for Medicaid recipients. So although we did everything backwards and we were one of the last states to develop a workforce, we're one of the first states to have Medicaid reimbursement. And that's really helping to sustain and continue to grow and develop our workforce. So bear with me. We're just going to touch the surface here of Medicaid reimbursement, just so you have a basic understanding of what it looks like. So for an individual to work with a CHW and for that CHW's organization to receive reimbursement for working with a Medicaid recipient, an individual patient needs to have a qualifying condition and or a qualifying barrier. So qualifying conditions, this is not an inclusive list, but looking at chronic diseases, looking at mental health conditions, looking at high-risk pregnancy, substance use disorder, tobacco use, again, not an inclusive list, so it can be any qualifying condition that the provider is hoping the CHW can work with that patient regarding their qualifying condition and that specific scope of work we just covered. But it's also looking at qualifying barriers. So geographic distance from health services, and that's not defined. It's up to the provider to decide if the patient has a geographic distance from their health services that's causing that barrier. Here in South Dakota, you could live in Mitchell, South Dakota. You use a wheelchair, it's winter, and there's 2 feet of snow on the ground, and you need to go 2 miles to your appointment. That's a huge geographic barrier. You could also live in Faith, South Dakota, and need to go to Pierre for a medical appointment, but you don't have a car. So geographic distance is not defined. Also looking at lack of phone. So this is typically where individuals are going to the wrong location for care. They might be going to the emergency room repeatedly versus establishing care with a primary care provider. Looking at cultural and language communication barriers. This is not only looking at working with patients or clients who don't speak English as a primary language, but also working with patients and clients to understand complex medical terminology and really having a CHW be able to work with that patient to understand their chronic disease, understand the situation, and then help them overcome those barriers and better address their care that they're being provided. And then again, also looking at social determinants of health barriers. So food, housing, transportation, childcare, having working appliances in the home, having clothes to wear. It's really looking at those barriers to your health that are not directly your health, but still affect your health. So one more page of Medicaid reimbursement, and then I promise we'll move on. But Medicaid does require that the CHW services are provider ordered by a doctor, a physician's assistant, a nurse practitioner, a certified nurse midwife, or a dentist. And CHW services must be provided by an enrolled CHW agency. And then, as mentioned previously, CHWs and CHRs providing these services do need to be certified. There is a maximum of 5 units, or the equivalent of 2.5 hours, that can take place in the clinic setting before services need to transition into the home or community setting, unless the CHW is attending an appointment with a patient. And that's really focusing on that role of connecting with the community and really going and leaving the clinic setting, if it is a clinic or medical-based CHW program, and going into the community, going into the home, and being the eyes and ears for the providers and being able to assess the situation and work through, especially those social determinants of health needs that can have such an impact on one's healthcare. South Dakota is a very rural state, and so telehealth is also billable, with telephone encounters billable if there's a documented barrier to telehealth. So a lot going on there with Medicaid reimbursement. We have an 18-page document for Medicaid that goes through all of the logistics. But overall, the big takeaways are just the services need to be provider ordered. The CHWs need to be certified. There needs to be services taking place out in the community setting. Telehealth and telephone encounters are also okay, but really looking to leave the clinic walls and go out into the community and the home. And overall, those services are billed at the hourly equivalent of $64.86 per hour. So what that means is, although this is a lot going on and there's a lot to work through with this Medicaid reimbursement, it is worth it in the end because $64.86 is not only covering the hourly wages of that CHW, but also covering time when they're not in a billable appointment with a patient or client to cover their travel time, documentation, etc. Typically in South Dakota, CHWs make $17 to $22 an hour. And we're really looking for individuals who can connect to their community. And so they have that lived experience, have that same chronic disease, are from the community, speak the same language, and are really individuals who aren't nurses, who aren't social workers, who don't have bachelor's degrees or master's degrees, but really those individuals who can connect to the community. And that also really allows individuals who are social workers, who are nurses, to be able to work at the top of their license and then have CHWs work through their specific scope of work. So that's a quick overview of Medicaid reimbursement. If you are really wanting to take a deeper dive, I put the link at the bottom to pull up that full 18-page billing and policy manual. But overall, we're really excited here in South Dakota that we have access to that Medicaid reimbursement, and we actually have the highest reimbursement rate in the country. So we're really excited to have that here in South Dakota. So with that, I want to take a quick pause and see if anyone has any questions. Otherwise, I wanted to wrap up with sharing a few success stories from here in South Dakota. So any questions anyone has before we jump into success stories? Well, hearing none, my email address is at the end of the presentation. So if you're watching this later and have a question, feel free to reach out. But this is probably my favorite part of my role as the community outreach coordinator for the Community Health Worker Collaborative, and that's sharing these success stories. Over the last 3.5 years, it's been amazing to watch these individuals start in their new role as CHWs and then train in a training program and then start to work as CHWs across South Dakota. And so to be able to come full circle from helping to develop this workforce to now having success stories here in South Dakota is so rewarding. So I want to start out with a video which includes a couple success stories from the Avera Community Health Resource Center located in Sioux Falls. So the Avera Community Health Resource Center is located on the Empower campus in Sioux Falls, which is in eastern Sioux Falls. It was previously the South Dakota School for the Deaf campus, and it is where a lot of nonprofits are housed within South Dakota. And so Avera employs 6 CHWs within their Community Health Resource Center in that location. Collectively, those 6 CHWs speak 16 different languages. So they're really able to connect with the community and population that they serve. They're physically located in the right spot, and they also really are able to connect with those community members. So I'll preface pulling up this video by sharing that it's on YouTube, and there might be a YouTube ad at some point. So it pops in here and there. It's very popular as far as how many people have watched this video. So it's gotten to the point where it has some sponsored ads here and there. And we're going to start right in at
one simple but brilliant trick to heat your home
here. And then from the success stories, we'll hear those 3 success stories, but there is a longer video that goes through a more significant overview of the program. So we're going to watch a quick ad here for 26 seconds, it looks like, and then we'll jump into the video.
Home in 90 seconds and save thousands of dollars on your heating bill this winter.
I can't think of an experience through the Resource Center that better demonstrates compassion than this story. One of our CHWs was recently contacted by a clinic about a child with several medical issues, one of them requiring tube feedings. Those tube feedings were generally provided by the school nurse. The child missed close to a month of school, and the last time the nurse administered the tube feeding, 3 cockroaches came crawling out of where the tube enters the body. As required, the nurse filed a CPS report, and the family had refused interpreters at Avera in the past due to lack of trust, really, in this tight-knit community. While we were very concerned that the family would refuse our services, our CHW met the family at a recent appointment with the provider. Not only did the family accept the help, our CHW was able to find out that the family's landlord was not taking care of the cockroaches after concerns were brought forward. So our CHW called and arranged for an exterminator to come and take care of the infestation, as well as follow up in the future. By exemplifying compassion in this interaction, not only was this child and family helped, but trust began to build with that entire community. Hospitality, the second of Avera's values, is expressed by means of welcoming presence and attentiveness to needs in a gracious manner. A man from our community of one of our CHWs had fallen in the snow and was unable to get up for some time, causing severe damage to the patient's leg. He was hospitalized at an Avera hospital, and eventually the care team made the difficult decision that the leg needed to be amputated in order to save the patient's life. Our CHW went to visit the patient while he was in the hospital, where the patient shared concerns about what happened when he would be released to home. Because of the established trust and shared lived experience as an immigrant, the patient asked our CHW for help to make sure that those things would be ready for him when he got home. So our CHW reached out to the social worker in the hospital, collaborated to get grab bars and other aids placed in the home, as well as a ramp to be able to get in and out of the home. As the man was discharged to his home, he continued to deal with phantom limb pain, which causes discomfort and pain in the limb that's no longer there. Some within his community did not understand this condition, leading to concern for the patient's mental health. So our CHW was able to share that this is actually very common in amputees and was able to educate the community about it, as well as help provide the patient with resources for support, as well as treatment options to help work through the pain.
How does this weird tiny device help with dust and airborne pollutants? Studies show that air pollution can be 5 times worse.
Stewardship, the third of Avera's values, is extremely important to our work to be able to be sustainable. Avera treats all resources with justice and responsibility. Our CHW received a referral from one of our clinics asking for help with a non-English speaking parents of a child that they were seeing. The young child had Down syndrome, and the care team felt that the parents didn't seem to understand the severity of the diagnosis, and in fact weren't even aware of the diagnosis until recently. There have been many missed appointments by this family due to lack of understanding and difficulty in finding transportation. Our CHW met with the family and provider appointment. After doing some research, found out that people in this culture believe that these types of conditions are actually caused by the use of birth control. This causes deep shame. So our CHW found out that this is why the family didn't take this condition seriously at first. This is one of the most powerful abilities of our CHWs, to not only interpret language, but also culture. Our So
that was 3 success stories from Avera Health in Sioux Falls. Again, apologies for the YouTube ads. It's a very popular video because we've been sharing it a lot, as has Avera, because we really want to celebrate those success stories and the great work that CHWs are doing across South Dakota. I wanted to share 2 more quick success stories. This story is about the impact of a home visit, and really CHWs going into the home and connecting with the patient or client can often be that tipping point for that patient's care where things continue and nothing is improving. But after the CHW connects with that patient or client in the home and is able to report back their findings and address those social determinants of health needs, the patient typically has improvements and is able to further focus on their health because they're not looking at those other barriers or focusing on those other barriers to their health. So in this situation, a CHW at Sanford in Sioux Falls received a referral to work with a gentleman in his early 60s who continued to have uncontrolled type 2 diabetes. The provider shared that the patient had a very high A1C. So the CHW conducted a home visit and assessment of the patient's home, and using a screening tool, visited with the patient about his social determinants of health needs. So although the patient indicated he did have food when asked about food and availability of food, the CHW still asked if he could look into the patient's fridge and cupboard to see what food the patient was consuming, knowing that a patient with type 2 diabetes needs to consume high protein, low carb, low sugar foods. So after taking a look into the patient's cupboards and fridge, the CHW realized the patient was only eating ramen noodles and only drinking Mountain Dew. So the CHW shared with the patient concerns about the food he was eating and his type 2 diabetes diagnosis, and learned that the patient really didn't have any other access to food. He lived right next to a gas station, and that was really all he could afford and all he was able to purchase. And so the CHW helped the patient to secure food appropriate for his needs and worked with the patient to continue to receive healthy food so that the patient continued to have food delivered and meals available that matched his dietary needs. So really, it was just this small amount of support that was really the critical shift needed to help that patient lower his A1C. So the CHW provided some additional services to the patient, made sure that the patient was getting their medication delivered to their home because they didn't have transportation, continued to make sure that food was delivered. And through that work, and through access to healthier foods, the patient's A1C decreased significantly at his next clinic visit to a more normal range. So really, that quick glance into the cupboards in the fridge was really what was the change needed to help that patient and then address those social determinants of health needs. And finally, this story focuses on an individual who is homeless and is now transitioned into housing. Cottington County Welfare Office in Watertown worked with a client who was a 35-year-old woman who faced a complex set of challenges. She was struggling with depression and anxiety, and Cottington County Welfare Office indicated she also exhibited a state of low functioning. And so the client had been experiencing homelessness for the past few months. And so there was really a barrier to her overall well-being, and she really needed to stabilize her housing so that she could then assess her mental health needs. So the CHW worked with the client to set goals. One of the goals was to secure housing. So the CHW worked with the patient to apply for income-based housing, and the patient was then able to work with a property management company. And when it came time to going to sign paperwork, the CHW accompanied the patient to the appointment. And at the appointment, they learned that the patient had a petty theft charge that was showing up in a background check. But the property manager encouraged the patient to prepare an appeal letter. And so the CHW assisted in preparing the appeals letter with the patient to outline her commitment to self-improvement. And by assisting the client in crafting that appeals letter, that CHW really played a pivotal role in advocating for her housing application. And she was ultimately accepted into the housing complex just a few days later. And so it was really through the CHW's assistance in navigating healthcare that patient now has stable housing and is able to focus more on her mental health concerns. So those are just a couple of success stories about CHWs here in South Dakota. Just a quick overview. We have CHW programs across South Dakota. If you're interested in learning more about what specific organizations employ CHWs and where they're located, we have a resource on our website that navigates through 6 different regions. Sioux Falls and Rapid City are their own regions, and then we have the state divided into 4 sections, and you can go in and see who are the CHWs within your community. So to wrap up, I just wanted to share a quick overview of the Community Health Worker Collaborative of South Dakota. Our mission is to promote, support, and sustain the CHW profession in South Dakota. And as I mentioned, the CHWSD is an extension of the South Dakota Department of Health Office of Disease Prevention and Health Promotion. So we really work on 5 key areas in developing the CHW workforce and sustaining the CHW workforce here in South Dakota, focusing on awareness. So sharing information about the developing workforce, training, workforce development, reimbursement, and then career ladder and cross training. So really helping CHWs to advance within their profession, and also looking at helping individuals to cross train into a CHW role. So that was a quick overview of the community health worker workforce here in South Dakota. Hopefully you have a chance to take a look at the website and find out where CHWs are within your community. And if it comes up in the future that you're able to work on a project for school or connect with CHWs, feel free to reach out and make those connections. Our CHWs continue to connect with health professionals across South Dakota. And if you have any questions or have anything you'd like to share, please don't hesitate to reach out and send me an email. So with that, any questions anyone has or any follow-ups?
I guess one plug we'll throw in here for the scholars is we will be doing community projects or funding community projects again this year, and one of the emphasis is potentially partnering with a community health worker and doing some sort of community education project with that. If you look out for more information, it'll be coming out in the next couple weeks or so, as those are great opportunities to really connect with your communities. Any other questions or comments?
Hey, Michaela, I don't know if you've seen my email. I got on late.
Yes.
This new iPad, I thought I had Zoom on it and I didn't. So I was slightly late, but I caught a good majority of it. So
Perfect. Thank you, Taya. Awesome. Well, that's all we have.
Awesome. Well, thanks so much.
You, Ben. We appreciate it.
Yes. Have a great rest of your night, or if you're watching the recording, have a great rest of your day.
Awesome. Thanks.